My name is Austin Kiel. I'm a physical therapist here at Franciscan Health. So cupping is a soft tissue manipulation we use to treat the kind of underlying tightness within a muscle that we hope to decrease pressure on certain painful areas. So the big thing with cupping is trying to release the tension in the muscles. What we try to do is use air pressure to relieve the underlying tissue to encourage blood flow to get into those, let's call them, damaged areas. The main difference we use with cupping is when we do other forms of soft tissue manipulation, a lot of times it's very compressive. And with the cupping, it allows us to kind of open up the space within the tissue and allow that blood to get into the area. It's gonna depend on every patient. Some people feel it the first day. For someone with a more chronic condition, may take a few more of sessions to really feel that difference, but each time you're going to feel something. The big difference is you're going to feel relief in that tension. It may be short term, it may be long term, but you're going to feel a temporary relief of that chronic tension. Cupping is very safe. You may feel some discomfort, some pain that may last 24 to 48 hours. A lot of times there's going to be a very distinctive circular bruise that's left from the cup that will leave probably 3 to 4 days, but the long-standing pain from them, no, there's no major indications of that. Cupping is used in a very wide variety of treatment areas. We mainly see the biggest difference in the back and neck. Relieving those chronic tissues that are always on. There's nothing you need to do to prepare. The treatment is very low stress. It is usually 5 to 8 minutes at the longest. And the expectation is if you are going to be exposing that tissue around the neck or back, say for a wedding or going to the pool, to kind of expect to have some questions. So the big point of cupping is we try to release the tension of the muscles underneath the skin. Unfortunately, it does leave the bruising and the long-lasting discoloration of the skin, but nothing actually happens to the skin. It is more to treat the muscles underneath. So the goal of cupping is not to cause a detox or go for a detox sensation. We typically try to lean on more of the change in muscle tissue more so than a systemic response. So with cupping, you're going to get different benefits for each different condition that you're going to be treating. When it's pain, it kind of depends on how long you've had the pain or where the pain is at. Cupping used for recovery is going to be different just based on how we use it. We're going to use the cupping to kind of move the tissue around more so than what is called static cupping. Static cupping, we are going to leave in place to release the tension of a specific spot. With dynamic cupping, we're going to use it more to move the tissue around a specific treatment. The biggest thing of physical therapy, we like to rely on the motto of motion is lotion. We like to move tissue around. We like to make sure the muscles are working appropriately. And with cupping, we can do that very targeted to the tight tissue area.
So why don't you go ahead and start by introducing yourself.
Yep. My name is Austin Kiel. I'm a physical therapist here.